A Valley woman is working on the front lines against drug addiction. Her opinion is we need to look more at treatment programs instead of simply sending drug users to jail.
Now a local congressman is talking with his colleagues on Capitol Hill. He says the nationwide heroin epidemic will only get worse without more funding from Washington. 27 First News reporter Gerry Ricciutti joins us now with more.
Eric and Dave, the director of a local drug treatment program, told lawmakers today one of the biggest problems facing addicts is having access to the care they need. As addiction to heroin and other opiates intensifies, one local expert claims treatment centers like Meridian Community Services in Youngstown are feeling the strain.
I have clients waiting 30, 45 days to get a detox bed.
Andrea Paventi is director of Meridian's TASK program, which stands for Treatment Alternatives to Street Crimes. She spoke in front of a congressional drug addiction caucus this morning in Washington, saying the first contact TASK often has with addicts is after they've been arrested.
Our drug court population has gone from primarily crack cocaine in the early 2000s to now about 90% of everyone in our common pleas drug court has an opiate addiction.
Paventi says while treatment can run between $3,500 for outpatient care up to $15,000 for inpatient services, many low-income addicts end up behind bars, which she claims costs about $40,000 a year per inmate.
So I think it's realigning philosophies that incarceration isn't working. We're not dealing with the drug problem by incarcerating individuals.
Valley Congressman Tim Ryan, who co-chairs the Addiction Caucus, urged lawmakers in the House to provide the money necessary to cover treatment services.
And then people will say, well, how much does it cost? Well, how much is it costing us now? When people are dying of heroin more than they're dying in auto accidents, I'd say we have a national crisis on our hands.
Andrea Paventi tells me that while anticipated increases in Medicaid will help cover the costs of treating clients who are too poor to pay on their own, she thinks money specifically set aside for drug treatment programming will help those without enough insurance to pay for the treatment they need. We'll continue following this to see how lawmakers react to what they heard today.